Welcome to the EAU podcast series, Present and Future of Diagnostics in Prostate Cancer. In this fifth episode, we are joined by Associate Professor Henkjan Huisman and Dr. Alexander Yang. Together, they will discuss if artificial intelligence in prostate cancer diagnosis is hype or reality. Join us as we embark on this informative journey.
Welcome, everyone, to this podcast series, Present and Futures of Diagnostics in Prostate Cancer, and this episode, AI in Prostate Cancer Diagnosis, Hype or Reality. We're delighted to be talking about AI in prostate cancer diagnosis with you today. My name is Alex. I'm a PhD student at University College London, and I'm joined by my colleague, Henkjan.
Yeah, so I'm Henkjan Huisman. I'm an associate professor of medical imaging, artificial intelligence, with a focus on abdominal imaging and definitely also prostate imaging, which is a topic for today.
So maybe we'll start with a bit about where we are at the moment in the image-guided prostate cancer diagnostic pathway and how we got here. So some of you may know that prior to us using MRI in prostate cancer diagnosis, we underwent a period where we used transrectal ultrasound-guided biopsies of the prostate. And there were many flaws to this at the time, as some of you will know, that we would take biopsies from the prostate without knowing where the prostate cancer was. After a number of high clinical trials, including the Precision study, this led to international changes in the way we diagnose prostate cancer, with MRI being used before biopsy and us now using MRI-guided biopsies to diagnose prostate cancer. This led to international guideline changes and has essentially led to us now using MRI as the first-line investigation.
Okay, Alex. This image-guided prostate cancer pathway you described seems ideal, but what are the current limitations and why are not all the patients benefiting from this?
Yeah, that's a great question, Henkjan. So we know that there are several limitations to the current MRI-guided prostate cancer pathway. Firstly, we know that there is a predicted doubling in the number of prostate cancer diagnoses over the next 20 years, as outlined by the Lancet Commission. We also know that an insufficient number of radiologists present in the workforce to be interpreting these prostate MRIs. And the Royal College of Radiologists in the UK predicts a 40% shortfall by 2027 in developed countries. And adding to this, we know that prostate MRI itself is an expert skill with a steep learning curve. So when we add in additional healthcare inefficiencies, it means that not all patients are getting a prostate MRI in a timely fashion, but even when they do, getting a prostate MRI interpretation is sometimes difficult and with severe delays in the process. So as we've mentioned, there are several limitations to the current MRI-guided diagnostic pathway. However, artificial intelligence, which is the theme of this podcast, has been proposed as a solution to overcome these issues. Henkjan, you've led some groundbreaking work into AI in prostate cancer diagnosis, namely the PICI challenge. Could you tell us a bit more about the role of AI in prostate MRI?
Yeah, happy to do that, of course, Alex. So as you mentioned, the PICI challenge is the study is, I'm the PI of that particular study. And our intention was actually to investigate where is AI actually, so very relevant to the question that you mentioned. So we set out to do a non-inferiority study. And the way that works is that we have facilities, I can go about that later, to expose data to researchers that can develop AI. We can then develop a benchmark, a metric that identifies how good is the AI. And we have to build it in a way that we can also rank clinicians, radiologists in this case, to also read those data. And then the whole purpose of PICI was to compare the AI to the clinicians. Because, and I said at the beginning, we went for a non-inferiority trial, but we left open the possibility for superiority. And in the end, that happened, isn't it? The non-inferiority wasn't true. And in the end, we had to kind of conclude that AI, in this case, can be better than clinicians in general. And so we collected 10,000 prostates to train, but also to test all these kind of setups. So I think that is an interesting achievement, because in general, it says something about where is AI at the moment, isn't it? And we have now seen that with breast mammography. It's also kind of better than clinicians, and it starts to have an impact on healthcare. So there you could replace mammography radiologist or add one. Like in the UK, there's a shortage of radiologists. So I think then it becomes really important, isn't it, to have that kind of facility.
Yeah, as you mentioned, it was a groundbreaking study published last year in the Lancet Oncology, and amazing work by yourself and the international team as well. So based on the work you've done in PKI, Henkjan, where do you see the role of AI in prostate cancer MRI? Do you think it will be primarily used in the future as a AI assisted with the radiologist, or do you think we may see an independence reporting in the future?
I think in general AI, and that's kind of not just healthcare, isn't it? It's in general. If we see the rapid developments right now, the DeepSeek and the new AI that's coming out from OpenAI at the moment, to me it's pretty clear that AI is becoming better than us in general, isn't it? For healthcare, but like lawyers or programmers or help desk employees all need to kind of rethink what they're doing, isn't it, at the moment? So for healthcare, I think, so we have now shown it with a PKI study that indeed we can achieve AI that's better than clinicians. We see it with mammography. We see it with a couple of applications. And for me, that means that we now need to think about the next step, isn't it? How are we going to use that, isn't it? Is it indeed in an assisted mode, or should we maybe run it like automatically? But then use the benchmark and the committees actually that are behind those benchmarks as a way to control the AI. Yuval Harari, famous writer from a book called Homo Deus, and recently his book Nexus, kind of says the same thing, isn't it? You want to keep track of AI, you want to control it, and the way to do that is to build, let's say, committees, test it, benchmark it, and PKI could be a recipe for that. PKI has a scientific advisory board with 5 top experts on urology and 5 top experts from radiology and 5 experts from AI. I think that could be the recipe, isn't it? They are, let's say, the guardians of that particular domain, isn't it? And they could maybe help us to, in the future, guard that the AI that's running in healthcare is doing what it needs to do, isn't it? And it can do that fast, very efficient, probably to the best of its capabilities. But I know that clinicians don't want to hear this right now, isn't it?
As you've mentioned previously, the PKI study serves as, to some extent, the benchmark as a state-of-the-art academic algorithm as well. So it'd be interesting to see how future work looks to compare against PKI's performance as well. So we look forward to that. I know you've also been doing some work on AI in prostate ultrasounds as well. Would you mind telling us a bit more about this, Henkjan?
Yeah, so definitely. So of course, having the ability now to do AI on prostate MR allows us also maybe to look at other modalities. So prostate ultrasound is of course very important. You told us in the kind of history, prostate ultrasound has always been very important. But then again, those older ultrasound machines had a pretty low image quality. You could, let's say, see the prostate maybe, isn't it? But not even inside. What I see at the moment is that ultrasound has made remarkable achievements. The ability to depict like very small details, high contrast. Recent developments include 3D imaging. And I think, yeah, that makes it very interesting to look at, can we make it maybe a little better with AI? And that's a project that I started recently in a 2-stage project. First of all, to say maybe, can we improve the fusion biopsies? Because we all, or we urologists, do fusion biopsies, isn't it? As you explained, MR has a big role now for prostate cancer detection, and it can identify lesions, and then it can help target the lesions on ultrasound with fusion biopsy. But we all know that fusion biopsy is not that simple. Sometimes difficult to relocate lesions, and maybe with AI we can help improve that relocation. And the second goal could be, hey, maybe his ultrasound is so good, maybe it can detect the prostate cancer, isn't it? Without MR. And I think that's a pretty interesting research topic as well, isn't it? This could be maybe a cheaper alternative or patient friendly. I think these are kind of interesting targets to kind of explore, isn't it, in the ultrasound AI application here.
Certainly, as you've mentioned, saving time and saving cost is important in any healthcare setting. So if we can save time by registering the MRI lesions on ultrasound quicker and more accurately, that's always beneficial. But as you've mentioned, if we can potentially avoid MRI altogether and simply use ultrasound, then that would ensure that prostate MRI diagnosis is more accessible across the world as well, especially in places that don't have as easily access to MRI. So definitely look forward to some of the research you're doing on that, Henkjan. So far we've spoken about the role of AI from prostate MR interpretation and to biopsies on ultrasounds. What role does AI play in the MRI acquisition stage as well, Henkjan?
Yeah, again, interesting question, Alex. And I think AI is so versatile, isn't it? So why couldn't it do that as well, isn't it? I'm definitely have a couple of other research projects going on at the moment. Yeah, there's various ways to go about this. We have been doing, let's say, image reconstructions. So maybe we can make MR again, like efficiency. Can we make MR a little faster? Because we know it's not that fast, isn't it? So can we acquire less K-space lines, how it's called, and then with AI reconstruct them in nice images? And definitely that's feasible to a certain extent. By the way, we have discovered you don't go. Ideally, you want to make it very fast, but then you lose diagnostic power, so you don't want to do that. Another option is to maybe have MR built in that kind of diagnostic AI that we develop with PicEye, and maybe have it assess at the first couple of images, like, okay, this is really normal. Maybe you should stop scanning now automatically. Or if it doesn't know, it's uncertain, hey, maybe let's do a couple of extra acquisitions that make the diagnostic information more complete, maybe with a more certain diagnosis. So you get a sort of a variable length scan. That is very a novel topic. Other things include quality. I mean, we all know that the best quality data, best quality images produce the best quality diagnosis. So we're also investigating, can AI make an objective quantitative indicator for image quality? It's a difficult topic. We all know that there's a PyQual version out there, the version 1 and version, I think it's 2 right now. But that has some subjectivity to it. Maybe with AI we can make that a bit more objective. That will be great, that you can, at the scanning itself, give some feedback about the quality of your image. Yeah, definitely. Again, all kind of developments on making MR maybe a little smarter.
Certainly, Henkjan, as you've touched upon, subjectivity is unfortunately a flaw of humans, that even if we assess something again in the future, or even assess the performance between different radiologists, sometimes there are some differences. So as you've mentioned, if we can train the AI to be consistent and more accurate overall, then this reduces the heterogeneity in interpretation and assessment of quality. So that's absolutely very important as well. So another popular use of AI currently in mainstream world is the use of large language models. What role do you see this playing in the patient-clinician consultation, Henkjan?
Yeah, so I've been, as I mentioned in the beginning, I said I'm an associate professor of medical imaging AI. We realize that imaging, of course, is not the only thing. We are more and more also with imaging looking at text reports, just to kind of get the output. What is actually the prediction that you have to make on this particular patient? But we also are getting more and more experience with handling reports. So the large language models like ChatGPT and what have you are becoming more and more important. And everybody probably has played with ChatGPT, but then again, it's not optimally trustable. So what we're currently exploring is a novel technology called retrieval augmented generation, or RAG in short. And that can make the large language model think according to the guidelines. And I think that's a very interesting development. You can make it really stick to the guidelines, and it kind of gets an observation from all your data from your patient. What was the blood test? What was the prior information? Is there a patient history, etc.? And it will look up all the guidelines that are at the EAU, which contains a lot of guidelines. And the AI automatically figures out which guideline is most proper for this particular patient, or gives multiple suggestions. And I think that could be a very interesting role for AI in the future as well, isn't it? Not just looking at images, but also helping you predict the best next treatment, or the best next step in your intervention or therapy.
Certainly. So as you've mentioned, we can potentially be using AI not just for diagnosing patients, but also in guiding their treatments and management as well. So that's another very interesting avenue as well. And I suppose the other aspects of the large language models is potentially patients using it to better understand their disease, their conditions, their treatment as well. So that's definitely something we look forward to in the future for both patients and clinicians. So Henkjan, a lot of very interesting work is being conducted in AI in prostate cancer diagnosis. Even with all of this evidence, how do we get all of this into clinical practice?
Yeah, that is a big challenge at the moment, isn't it? Because there's a lot of AI developments going on, a lot of literature is appearing. The problem I see at the moment is that it's very difficult to trust AI. I mean, there's 1,000 AI applications being approved right now with the FDA in the States for imaging only. And I know a lot of radiologists don't have a lot of trust in them. So how do we get the trust, isn't it? And I think with PICI, the recipe of PICI is to do a benchmark, isn't it? Let's create a benchmark and have it created by the academic community as a third party, a trusted third party. In that way, you can build trust by saying, hey, this AI is indeed good. That your academic peers can really inspect the AI with a set of cases that has been endorsed by a community. And in this way, we can earn the trust of clinicians to tell them like, hey, this AI is really that good, isn't it? And then similar to mammography, that they are willing to say, okay, I accept that the AI is looking at my images, isn't it? And I think that's the future. We need to set up, to me, benchmarking committees, not just guideline committees that produce text, but I think benchmark committees that collect data, collect the reference standard, compute metrics, and then can help monitor AI or even healthcare in general, by the way. We have a new role for clinicians. They can be part of those benchmark committees. And I think that is an interesting future. Right now, maybe they're not there. I'm actually setting them up for PICI right now. This committee is set to live on. So it will accept people. It will remain there. And hopefully we can in the future, for the first time, with prostate MR AI, continue to monitor this AI and show the trust in something that you can buy it or install it and have it, use it. And I think that to me is the future. And there's tons of other topics that we still need to talk about. Bias, is it valid on all the patients, or all kinds of other. But that's the research, isn't it? So whatever we find, if AI makes mistakes, then you think about why does it make the mistake, and what can we do in the future to prevent making that mistake again. And if it's a different population or a different scanner, or hey, whatever, we find a new organ even. That's research. Let's find out how that works, isn't it? Change the benchmark, collect more data. And I think that's how I would like to be in the game in the future with AI.
Some very, very important points you've mentioned, Henkjan. But hopefully AI is not finding any new organs for us to diagnose anytime soon. But as you've mentioned, a lot of important considerations in the future, the legal aspects, liability, governance. And the important thing with the research, especially the work in AI, and is it becoming the hype or reality, is to leave a lasting legacy. And I think that's important with the governing bodies and oversight committees that you're planning to do. So I think we've given an overview of AI in prostate cancer diagnosis. So Henkjan, back to the question. Do you think AI in prostate cancer diagnosis is hype or reality?
That's definitely a reality. Maybe not right now in everybody's clinical practice, but it's there to stay. I think with PICI, we have shown that there's definitely an AI feasible right now that can help you make MR AI a lot better. I think the next step is to get the trust and start using it and make healthcare and patients a lot better.
I completely agree with you. I also think that AI is reality. It may not be here right now, but it will soon well be in our clinical setting in the near future. So with that, we would like to draw an end to this episode on AI in prostate cancer diagnosis, hype or reality, as part of the new series, Present and Future of Diagnostics in Prostate Cancer. We would like to say thank you in particular to the European Association of Urology and the European School of Urology for this opportunity.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.